Hi, I'm Dr. Frederick Strathmann, Assistant Professor of Pathology at the University of Utah and a Medical Director of Toxicology at ARUP Laboratories. In the next few minutes, I'll discuss several approaches for detecting in utero drug exposure using umbilical cord as a specimen type. For specimen requirements, the typical recommendation is to collect at least 6 inches of umbilical cord that has been drained of excess blood and has been rinsed in normal saline or sterile water. It's important that the umbilical cord is patted dry prior to shipment to ensure the cord is not left soaking in residual blood or other fluid, as this can compromise the detection of the drugs that are present. For analysis, several methods are available, including immunoassay, tandem mass spectrometry, and time-of-flight mass spectrometry. Both types of mass spectrometry provide high specificity, while immunoassays can be less specific. But it is important to remember that some immunoassays are quite specific and can even be more sensitive than mass spectrometry. An immunoassay for marijuana metabolites is a good example of a relatively specific assay, and because of the large number of marijuana metabolites that may be present, it can also be very sensitive, since all cross-reactive metabolites are summed into one final signal instead of individually measured as in mass spectrometry. But mass spectrometry is extremely useful for classes of compounds such as opioids, benzodiazepines, and stimulants. With mass spectrometry, it is possible to detect and report individual compounds, providing important and needed information. For example, hydrocodone use during pregnancy can be determined by detecting hydrocodone itself or related metabolites such as norhydrocodone, dihydrocodeine, and hydromorphone. The ability to detect and report metabolites in addition to parent drugs increases the chance for detection. Although relatively new in the clinical laboratory, the use of time-of-flight mass spectrometry has provided a highly specific alternative to tandem mass spectrometry. Instead of using fragmentation, time-of-flight mass spectrometry uses accurate mass, isotope spacing, and isotope ratios to identify compounds. In time-of-flight mass spectrometry, gas phase ions of various mass-to-charge ratios are pushed towards the detector at the same time using the same voltage. An ion that has a small mass-to-charge ratio will travel quicker than an ion that has a large mass-to-charge ratio. The time that it takes a given ion to travel or fly to the detector is related to its mass and forms the basis for time-of-flight mass spectrometry. Quantitative or qualitative results for individual compounds can be provided when mass spectrometry is used. A targeted, qualitative screen using mass spectrometry can provide faster turnaround times when compared to conventional screen with reflex to confirmation approaches. In addition, in a non-forensic setting, if the initial targeted screen is done using tandem mass spectrometry or time-of-flight mass spectrometry, no confirmation testing is required because of the high specificity of these approaches. With reduced turnaround time and no need for confirmation testing, the use of umbilical cord as the specimen type and mass spectrometry as the detection method can help to reduce overall costs while providing the same high-quality data needed for clinical decision-making and risk assessment. More information about the use of umbilical cord as a specimen type for the detection of in utero drug exposure can be found on our website and in the peer-reviewed literature. I appreciate you taking the time to view this short video, and as always, should you have any questions about this video or laboratory testing in general, please don't hesitate to contact us.